start. Thank you very much, Dr. Gill, for being back with us and for sending us our answers in such a timely manner.
Thank you.
If we could begin with the first question, do the members have any follow-up questions on the answer to question 1, which was Representative Walker's question about COVID dollars? No? Okay. And is it okay if we move on to question 2? Okay, I followed up on your statement from your testimony about homicides and drug intoxication. You didn't offer any testimony about suicides, did you?
No, we still have a few that are outstanding, although from my initial looking at some of the numbers, it looks like it's probably going to either be about the same or actually maybe even a bit of a decrease in suicides, actually, which, I spoke to some researchers at Yale who were interested in those numbers, and they thought that was kind of what they would expect in something like this. So that was surprising to me. But it's certainly, they're not going to be increased from last year. That's for the prior year. I'm certain of that.
So the observed is less than the expected. That's really interesting.
Is there a reason, Dr. Gill, that they think that's happened?
I didn't go into that much depth with her, but I, like you, assume that when people are being at home and they're,
isolation.
During times like this, it's sometimes people that they do note that it goes down for some reason. Yeah. Really?
Wow, that is very interesting. Thank you.
Well, the CDC just issued numbers on injury by firearms today, and the pattern is pretty much as one would expect. The intentional homicide tends to be the 18 to 24-year-olds, and the suicides tend to be over 65. But I haven't really reviewed the chart. I was waiting for another committee to give us information. But thank you very much for that. It may have something to do with decisions we have to make in another department. Let me see where it is, and I apologize for not printing out your answers. Representative Candelaria asked about the requested budget. So you got less than was requested.
That's correct.
And Representative McCarty, I don't know if I saw her before I went on this document, asked some really helpful questions at breaking out what the staffing needs are in terms of your work volume. So in order to keep accreditation, we would need mortuary operations, investigations, and medical records, or I'm trying to make sense of all your bullet points here.
Sure, those are the kind of the three areas that we focused on, but in a way, every part of our agency is all a link in a chain. We have one, directive, and that's by statute to investigate sudden, unexpected, suspicious, or unnatural deaths in the state. And by law, we have to do that. And I unfortunately can't control the number of deaths or the types of deaths. And so and as those deaths that we're seeing are increasing, it puts more of a stress on all sections of our office. We start with a phone call to our office with a death. So we have our phone people. Then that goes to an investigator who has to go to the scene. If there are more deaths, there's more work for them. And then we have to have transport people bring the body to our office. was more work for them. Then we have the medical examiners and the mortuary techs, our laboratory assistants, our medical records people. So it builds on everyone. And if there's a breakdown anywhere in that chain, then frankly, then the families are the ones that are going to be affected, right? And that's what
well, I was going to say that we haven't talked about families very much, but I remember from the height of the opioid issue in some parts of the state, the anguish of some families that had maybe a 19-year-old die unexpectedly, and then they had no closure because the state wasn't keeping up, which was not the fault of your office. In fact, one year I think your department was cut and it already had a deficiency. So if you could take all of this and prioritize, I understand everything is connected, what the top priorities would be if we were to, I don't know what the revenues are going to look like. And there's a lot going on, but obviously this has an effect on your accreditation and on the families who really need closure. If you could prioritize those, that would be helpful.
Yeah, I mean, I think that kind of that bare minimum, which we put in last year, would be another medical examiner, another investigator, and then another autopsy technician who helps us in the autopsy room. Those three positions were what we initially put in last fall. Obviously, things have changed, but I think at a bare minimum, that would certainly be helpful for us.
One medical examiner.
One investigator, a special investigator, and one mortuary technician.
Okay. Is Representative McCarty here? It was her question, and I wanted to see if she had a follow-up. No, I don't see her. Do any committee members have follow-up questions on this information?
I do have another question, Dr. Gill. I'm wondering if we're getting any of the stimulus money from the federal government coming in. Is there anything, obviously you wouldn't necessarily use it to hire staff this way because it wouldn't be long term. But is there anything in the short term with everything you've dealt with through this pandemic that you could have use of those monies?
Yeah, I mean, we have tried. I think we've gotten about $32,000 in the CARES Act, and I think we submitted some money for FEMA, which I think it was about $13,000 that went back to the state, didn't come back to us. But we were kind of limited about what we could put in for that. It was mostly supplies and things like that. But right. We have a refrigerated tractor trailer that we're keeping because we need that for extra bodies, frankly. We have more people having to work on weekends, and we can't really cover that staffing with those federal dollars because it's not maybe a direct COVID thing, but it's a secondary effect of COVID in a way.
Okay.
But Senator, wasn't your question about the stimulus dollars going forward, or was it? Because
yes, like the money's coming in. So that's.
But we don't know the regs on that.
Yeah,
we don't know what it's going to be. So I just would say, if there are things that you can think of that would be helpful to your department, you might want to send us an email and let us know what your wish list could be. I know we don't know the requirements yet or what the parameters of those monies are going to be, but it would be good to know.
No, that would be great. Yeah, we've done COVID testing and things that we've had to pay. So things like that certainly I think would fit. Yeah.
Right. Great. Thank you.
Okay, great. And any other questions on this particular answer? No?
Madam Chair?
Yes?
I did raise my hand. I'm sorry if you didn't
see
I
apologize. I don't look at
that's
that.
Okay.
Yes.
That's
Go
okay.
ahead.
Not a problem. I just want to support what Senator Abrams said to you. I believe that there's an opportunity here with some of the stimulus money to help even on a temporary basis for you to hire people. I think that part of the stimulus information that we're getting, and just so you know, I do human services, so a lot of my information is based on that. I am the co-chair of that and also for appropriations. But my understanding is you can use those dollars on a temporary basis. So consider that also as you're thinking about how some of this could be relief for you, right?
Correct.
And so, going forward, that might be something that we can help. And the senator is correct. you need to just reach out to us and let us know, because that's what we're here for. We can't do our job in this budget if we don't know what your needs are or how we can help you. So thank you for being here today, and thank you for all you've done. I know it's been really, really difficult for your department going through this COVID. I can't even imagine the stress level of the 7 days a week, and I'm sure your employees are still working the 7 days a week. And, I just want to say thank you. I know it's been a really rough year.
Thank you. I appreciate that.
We will expect then that you will get a breakout, assuming how much flexibility we have in spending it. Anything that we could do that might be temporary.
Okay.
That is, I know that in some departments, they don't want us to use stimulus dollars because they don't want to fall off a cliff. Although it's a question of when you fall off a cliff, I guess. But if you could provide that to the administrator of the committee, or actually to OFA probably.
Yeah, you can send it to OFA.
Yes, right. Send it to OFA. That would be really helpful to guide us in prioritizing.
All right. No, we'll definitely do that. Thank you. Thank you for remembering us and thinking of us. I appreciate that.
Okay, great. Any other questions? Senator Austin? No? I shouldn't do that because I've been in 2 meetings many times. Empty chair, okay. Well, if that's all, then we can wrap up. Okay,
Yeah, thank you very much.
thank you. Is the committee, are the members satisfied that we've completed our work here? Okay, thank you.
Thanks.
Well, maybe that will give us time to read the material from DDS.
What time were they coming, TDS?
They're supposed to be 2:30, but if they're in the waiting room, you might be
If
able
they're
to,
in-
Madam Chair, start earlier. We've done that in a couple other
Yes, we have.
subcommittees, but I'll leave it up to you.
Yeah, are they here?
I don't know, Ally?
It seems like a few of them are here, Madam Chair. If you wanted me to let them in and see if they're ready.
Yeah, let's let them in and
Yes,
see if
why
we
don't you
can
do
round
that?
up the rest of them. Yeah.
Letting them in now.
Good afternoon, everyone.
Good afternoon. How are you, Krista? Long time no
Good.
talk.
Very nice to see everyone.
Hi, Krista.
Good afternoon, everybody.
Hello,
How's that
how are
cutie
you?
patootie son of yours?
He's wonderful. Thank you
Good
for
for you.
asking. 2.5.
Good for you.
Interesting age.
I remember when you were pregnant. That's amazing.
It very much is. I think we're just trying to determine if the commissioner is on. I know the last
I'm here.
working group.
Yeah, we
Wonderful.
see him. Yep, he's there.
Great.
Jordan, it's nice to see that you follow Human Services, even though we don't fall. You don't fall under our committee. Thanks for the text message.
You all talk about us a lot in that committee. Someone's got to be paying attention to all that.
Listen, we're always standing up for you and supporting you, Commissioner. You know that goes without saying.
I know you are.
Anytime you want to come to the Human Services, we'll take you.
Thank you.
Here you go. And Commissioner, just to clear when I asked you a couple of questions at the last meeting and you commented you thought you knew who I was hearing from. And I guess you meant the parents, but actually the students are constituents of mine, and about 30 of them are my Facebook friends who were kind of locked down without vaccine. So actually reaching out to me in messages is, not much of a substitute, I must say, but I'm hearing from them. Is it the committee want to start on the questions? And
Yes, Madam Chair, it might be helpful if you go through them one by one, and then if there's no questions on them, you can move on to the next one, if I may suggest.
the total number of currently vacant positions in the agency, how many of these positions has the agency been authorized to refill? So you've been approved for 95?
So we have,
378 vacancies?
that's what's approved currently is 95 of those vacancies. But we do anticipate, because the second question, to be refilled by the end of the fiscal year, that there'll be 283 that will have authorization to fill by year's end.
Now, because you're going to be doing some part-time, is this broken out by FTE versus part-time?
So there was a time where position counts were only full-time employees and not full-time and part-time. But Scott, if you're on the call, if you would articulate whether this number is inclusive of both or just the full-time.
This includes part-time and full-time, and it's not a count of FTEs. It's a count of bodies or individual people, potential employees.
And just one other clarification, that the part-timers, the 200 part-timers indicated in the governor's budget to reduce overtime are not included in the numbers there, correct? I lost Scott. I don't believe that's inclusive of the 200 additional part-timer employees that the governor's budget indicates.
Christina, would you have a sense of that?
I would, I would lean towards it not including the part-timers.
I'm sorry, that does not include. I was struggling to unmute myself, so apologies.
Thank you. If Christina and Scott both say it doesn't include it, then I'm now very confident it doesn't.
Well, no disrespect, but I agree. Okay, and the 283 is question 2.
Yes.
Now, the question 3 is the retirement cliff.
So the retirement cliff is interesting for us. To answer the question as it was asked, by July of 2022, we estimate that 457 employees will be eligible to retire without penalty. That means they have both their age and their years of service requirements met. Were all of them to retire, that would represent 16% of our current employees. I don't know. I think a lot will be determined based on the current collective bargaining process, as well as the direction the pandemic takes us in. But we will have to see. We have a lot of employees who are eligible who don't leave for whatever their reasons are, who have age and years and work well past that. So this is our best estimate. Depending on who you ask, it may be slightly lower, but 457 would be eligible if they chose to go at that time.
Do you have a sense of, I assume they're everywhere, but are there some areas of the agency that are more mission critical than others that would be affected by the retirement cliff?
My sense is that the bulk of those in that number, in terms of mission critical, are in fact direct care staff working in our public programs. In terms of how it would have an impact on our continuous operation, we go through retirement waves routinely in other areas, case management, resource management, but all of those we can cover gaps for periods of time during recruitment and replacement. The hardest part, though, is when we're missing them on the front lines.
Okay.
Oh, I'm sorry,
Do
go
the
ahead.
members have any, oh, I'm sorry, go ahead.
I did have a question. Commissioner, when I look at those numbers and, you know, that you have 378 vacancies and are approved for 95 to fill, what's the length of time it's taking to fill a position? From, you know, from the time it's vacant until you go through the process? That just seems a little concerning.
Well, thank you, Senator. It was concerning when I saw it too, but we have a stipulated agreement in place with 1199 that allows us to do batch hiring. What happens when we hire one position at a time and recruit for one position at a time, where we have a number of employees, is we end up with an internal game of dominoes where people will move from position to position. And so you post the one position you need filled, someone internally bids on that, and then you have to bid for the one behind and the one behind. By hiring in batches in cooperation with OLR 1199 and OPM, as well as DAS, we're able to do job fairs. So we bring a group in at a time. We do training for that group. It allows existing employees an opportunity to move throughout, you know, within our system, and get the jobs they want without creating that constant recruitment for a single position effect. So it looks daunting in the manner it's presented, but we do these a batch at a time. I believe that agreement also applies to the way we hire case managers as well, so we can do them in small groups. And that we have found that over the last couple of years to be it's much more effective with our training unit. It's much more effective for our managers. They have a group of recruits coming on at one time, instead of constantly having a handful of people in training and a handful of people moving through the system.
It sounds like it could work. What do you do when, do you have the ability to give people overtime to cover for positions? Like, what do you do when these positions are vacant?
Yes, depending on the bargaining unit and the job class, there's a variety of things that impact our ability to use overtime, more restricted in the non-direct classes than in the direct classes. But I mean, we historically have used a fair amount of overtime. We're doing our best to manage that. And the 200 part-timers next year will help us do even better with managing that. But we do have overtime available. The way our public services are set up in terms of direct care is we have our full staffing complement, and then we have what's the bare minimum they can run on. And then we supplement somewhere in the middle with overtime when we have vacancies. And then we also use the opportunity to shrink some of our public footprint, which has been the general trend over a number of years, and consolidate programs or resources so that we can also minimize impacts of overtime. And I believe one of those is also a public group home closure is also indicated in the governor's budget for this year.
Right.
For this
And
fight.
do the part-time employees, are they members of 1199 as well, or no? Is it only full-time?
No, they're members. They get, and I think this may be answered somewhere else in the document, but they have access to varying levels of benefits, prorated based on their scheduled hours, their hours work. We are working across the table in our labor management meetings with 1199 to ensure longstanding employees have access to full-time employment. That's another reason for the staged hiring that we're doing, so that they have an opportunity to move to full-time employment. And the newer people are coming into their then vacant part-time positions. And periodically, our public management goes through and right sizes because the needs of people by home and program change. Sometimes we need more hours at a house, and that will change schedules, or less hours at a house because things are going well there, and we can do with less, and so that changes. Yeah, there are all bargaining unit members at multiple levels, even up to the supervisory layers.
Thank you for that, Commissioner. I appreciate it.
Of course.
Thank you, Madam Chair.
Thanks. I don't know if we asked you, it would be weird if we didn't. How many people, how many staff members were affected by COVID? That you would know off the top of your head, I guess, because it wasn't in a written question. And whether that had any impact on overtime. I know there were deaths, but I'm asking about people who were out.
I'm certain that Krista's in the process of bringing up our most recent numbers so she can read them to you from the chart. We update it frequently. But to the question of did it impact overtime? So to give you a historical perspective, we run on a daily basis with people taking some sort of leave time, FMLA, sick time, vacation time, whatever it may be. We average about a 4% staff vacancy rate per day based on that time off. During our summer highs over the last few years, when people are taking a lot of vacation time, we might bump up for a week or two, July 4th, Memorial Day, Labor Day, maybe to 10%. There were periods of time during this pandemic we were at 14 and 15%, not including the people who are out under authorized COVID leave. So there, and in order to make sure everyone was safe, there was a fair amount of overtime used. I'm certain it was the same case in private sector as well, but we certainly used our fair share of overtime during some very lean moments during the pandemic. Krista, did I vamp enough to give you opportunity to bring up that chart?
You did. Thank you so much. Good afternoon, committee members. So Representative Dillon, overall, since the beginning of the pandemic, we've had 470 staff test positive. That's about 17% of our total population. What we can report now is that we currently have 53 staff that are considered currently positive for COVID-19. And that number has been decreasing over the past several weeks. We do provide daily updates, figures for both individuals and staff on our website Monday through Friday.
I also want to add that late last night or early this morning, we lost another staff at DDS, not under direct care ranks. But as much as we're beginning to see light at the end of the tunnel, it was a stark reminder to us of the dangers that still exist for people. So we're mourning her loss today. We'll hopefully have some time to celebrate her life in the upcoming weeks.
So sorry to hear that, Commissioner.
Thank you.
I'm sorry, this must be really hard on you, too.
It has not been the easiest year. By any means, and I don't, some of you I think already know, but I was out with COVID myself, and December is blurry for me just because it was such a strange event, and I had to step away from work. I have amazing staff who carried us through, but by the end of December I was working half days or 3/4 days, but I missed the first week and a half of December at the start of that post-holiday surge. So. And it's scary as hell. I know staff who fought valiantly for their own lives and to protect everybody else, but it's very real. We feel it daily.
Well, I'm sorry, I hadn't really processed that, but of course, are there any other questions on this particular matter from the members? Well, we heard from a lot of the state employees, many of us, beginning in April, I guess, about the availability of PPE and their anxieties and all over state government. Are you comfortable that if anything happens with the variants that the department staff will be adequately protected?
Yes. So we have a 90-day supply on site in our own warehouses, and the EOC maintains an additional supply for us. In addition to providing for our own staff, we've been part of the distribution to our private providers as well. Currently, we are well outfitted with PPE. The problem with some of the PPE is that it's difficult to administer. So we continue to ramp up N95 fitting, where we were doing it from a different approach when those fitted N95s were scarce and very limited. We now have enough of a supply that we can do fitting ahead of outbreaks, and we're working to do some fit testing clinics, but we're adequately supplied now, and I think we'll get through that if there is another wave, and I really hope there's not. We have the added advantage of our congregate settings, and particularly Southbury and the regional centers, as well as our group homes. Individuals we support and their staff are being immunized, and that will really, really help.
Welcome, Representative Betts. We were just talking about the availability of protective equipment for the staff of DDS. But we have our questions here, and before we move on to the next question, is there anything you wanted to ask?
You're muted, Rep. Betts.
Thank you. Yeah, when I have something, I'll certainly call back to you, but I don't have any questions at the moment. Thank you, though.
It's good to see you.
I didn't see Representative Ferraro there. He just popped up on my screen here. So did you have any questions?
No, I just got in it, so I don't really know what's been asked and what's been said so far. So I'm going to just listen and see if I can catch up. Thank you. You're muted, Madam Chair.
This is never going to get better. We're going through the questions in order, and the answers were provided to us about an hour ago. So some folks are just catching up. So no worries.
And I apologize. We have an internal approval process for these answers, and vetting them and double checking them with everything else we're doing took longer than it normally does. We like to have this to you with more time to review. So I apologize. But if there's any questions you didn't think of while we're visiting with you today and you have follow-up, of course, we'd be happy to answer. Or if there's questions about the written answers we've given, we'd be happy to clarify and take additional questions following our scheduled meeting time. So, but we do apologize.
Yeah, certainly appreciate. No need to actually apologize, because it has been a very busy and stressful and challenging environment. So I fully appreciate the amount of work and time that everybody's putting in.
Thank you.
And thank you, Madam Chair.
Thank you. I appreciate your comments, Commissioner. We just want to do justice to your answers, and we're also facing deadlines. So, as you know. So, the next question.
Next question is on COVID relief funding. We've given you a grid of that, a chart as to how the funds will be spent. I'm happy to talk about any of the specific lines, or more specifically ask Scott to help elaborate if he's our CFO. We didn't do the formal introductions we do at the typical approach hearing. So, but I don't know if there's questions there. If you have questions later on, we can mine that data and break it down to some.
I just want, Commissioner and Madam Chair, I just want to make sure that I'm correct in this, and I'm 99.9% I am, but all the COVID funding that you've received, that is not subject to being reimbursed, is it?
So I'm going to try and restate the question in our internal lingo. Or let me ask, are you asking if any of the funding, the CRF funding, is subject to cost settlement, or are you asking if any of the CRF funding is eligible for matching other funds?
No, it's the former.
Okay. Scott, do you want to talk about cost settlement specifically? Normally I'd be comfortable handling this on my own, but there's a number of factors. One, we have a pilot on cost settlement that was underway before COVID started. Two, there were PPP loans separate from CRF, and there was some reconciliation we needed to do there as well. And so and my computer says it's going to restart. So hopefully that doesn't happen. But Scott, do you want to help with that?
So, based upon guidance from the Office of Policy Management, our contractor providers that receive coronavirus relief funding had until the end of December to spend it. They have submitted attestations to the department identifying how much of what they've been provided was used to cover costs that are qualifying expenses. We're going through that now, and we'll be cost settling on that, meaning that if they have an excess of money received over what they have qualifying expenses for, we'll be taking that back.
Okay, thank you.
Thank you. And that's specifically CARES Act money. Is that true?
Yes.
I'm all done, Madam Chair.
Thank you. Are there any further questions on this particular response to answer number 4? We may come back to you on this, Commissioner.
Absolutely.
But we're also anticipating other dollars from Congress that we haven't gotten regulations on yet. And I wonder if you have, or if you could identify any needs the department may have that could be potentially funded by those dollars if they're relatively short term, maybe a year or two.
I've been looking at some of the language with the most recent passage of the relief bill as well. So there's a couple things in there that may support issues or concerns we have going forward, including an enhanced FMAP, the federal matching funding. I don't know how that enhancement will be applied and if it will cover all home and community-based services or not. It was relatively vague. So we'll be working with our partners at DSS and OPM to better understand that and how it might be applied. Additionally, there were more rounds of PPP funding, and I believe in the specific language in this relief bill that speaks specifically to nonprofits. And so we'll need to see what that language looks at. In the way it has impacted us, as you're aware, some of you painfully aware, we had to make decisions about our day programs and keeping our whole system afloat. I can't thank Secretary McCaw enough for her collaboration and cooperation with what I felt were strategic investments of state dollars to keep us going, knowing that there may be additional federal relief. So I really need to discuss how that may impact some of the decisions we made, what can be done retroactively, what is only forward-looking. But we would look to cover some of the gaps perhaps that we created and increase access to additional supports if we're able. As you know, isolation, even now that we're going through the vaccination process, isolations and social distancing hasn't been working well for all of our, not for everybody we support, or for nearly anybody we support. So I have to take a look whether some of the technology money that's included in there or what we may do to further enhance the rest of our journey through this pandemic.
Okay. Do any members have any other questions?
I have, yes, Madam Chair. I have one question that pertains to the vaccination. Have you come across anybody who is not comfortable or refuses to take the vaccination from the people you serve? And if so, what is your response to it, or how do you handle something like that?
So there isn't a mandate. I think most of the people we support and their families and teams are pretty, because of the vulnerabilities that they face, are encouraged and are likely have a very high success rate. I think the area of concern for families, those we support, are that we may have some staff reluctance Hopefully, what's occurred at Southbury will be the same thing that happens as we continue to expand vaccines throughout the service system. Initially, in our initial clinics, we didn't, I believe our uptake of vaccine was at or around 40%. People were timid, but I believe now with subsequent offerings and connecting with community providers, we're closer to 60% there and maybe even higher. Today, that was the number from about a week and a half ago. So when I had my last Southbury meeting. So I'm hopeful that we'll see a general trend up. We use the ARC-CP did a video of questions and answers on vaccines with Dr. Edie, who's been part of the public-private partnership from us, I believe St. Francis, St. Francis. Now I'm confused, but he's a doctor and a smart one. He did a very charismatic interview with Wynn Everett on the use of the vaccine and why everyone should use it and why people who may feel timid would want to reconsider. So we've been sharing the ARC-CP's work with anyone who seems reluctant, and it speaks specifically to our community, but I think very broadly, it speaks to the value of vaccination. So we just continue to educate and provide opportunities and help people connect to our vaccine partners in the community.
Okay, thank you. Thank you, Madam Chair.
Representative Ferrara and Senator Aston.
Thank you, Madam Chair. For disclosure purposes, I got fully vaccinated as of Sunday, so I'm very pleased with that. And what I've noticed is that going to Representative Betts's question is some of the resistance that you see from people not wanting to take the vaccine is from misinformation or lack of information. And being that I'm the head of a large martial arts organization, I made it very public that I was getting the vaccine. And as a result, many folks in my organization who were questioning it have decided to go ahead and get the vaccine. So I think when high profile people are seen getting vaccinated, I think the resistance will decrease over time. My question, actually two questions, has to do with the vaccine and your experience at the agency level. Are much of the members of your agencies being vaccinated with the J&J version of the vaccine?
So the J&J just came online. In terms of people we support, I think we were already committed in congregate settings to vaccine providers utilizing the other major vaccine platforms. I do believe a lot of our staff, both in the 55 plus and coming up the 45 plus, are going to have opportunity for that J&J vaccine. But we as it's not a mandate, and because of HIPAA, we don't track back to the agency who got what, and in which vaccine, and so I don't have good data on that. I don't know if Katie Rock Burns, are you on today?
I am.
Do you have any specific? So Katie Rock Burns is my chief of staff, but she's been on loan as this has been a team effort across multiple state agencies. So don't confuse her for a DSS employee or a DPH employee or an Office of the Governor employee. She actually works here, although we haven't seen her much. But Katie, can you talk about your work with the vaccines and where you think we're at with that split for Representative Ferraro?
Sure, yeah. So as the commissioner mentioned, J&J is a relatively new product. So anybody who was already vaccinated as part of phase 1A as a healthcare worker, which represented a large portion of our industry, or anybody who is vaccinated in phase 1A based on the type of facility that they lived in, which wasn't a huge part of the individuals we support, but some, and then others who were vaccinated early in the congregate effort. That wasn't an option at the time. Moving forward, the vaccine providers are going to be using a mix of all three products. So we don't know actually, for the congregate facilities that have mobile clinics coming up or are accessing vaccine appointments in the community, it'll be the same mix as for the general public, which product they're using at those vaccine sites.
Well, are you concerned at all with the difference in the effectiveness in the various vaccines, whereas J&J is said to be around 66%, as opposed to after the second shot from Pfizer or Moderna, which is over 90%. Is there any concern with that?
So, no, so everything that we have heard about the vaccine, and we've talked, I know I don't mean to call her out, she may be away from her computer. Senator Summers is chair of the governor's Vaccine Communications Committee. So there are some materials that that group has shared specifically around that question. There you are, Senator Summers. And she may know a doctor or two in her life as well, but I don't know if, you know, there's good evidence that the best vaccine available is the one you can get the fastest. The more people we get vaccinated, the better. While the effectiveness rate that you mentioned in the mid-60s is one of the numbers being used, its protection against severe illness or protection from needing to be hospitalized is much higher than that. So that's the information we've put out, but I'm not a doctor. I rely on our partners at DPH and what we can get that's reliable. But I do believe that the Communications Committee has some resources that we've shared around that. And so you may be able to get better information than I can give you from Senator Summers or people from that group.
And my last question is, in your experience in data collecting, of the people who have received their second dose or are completely vaccinated, has there been any incidents of COVID infection following that?
I have to go back to one of, we have one instance that I'm aware of where an individual who had tested positive early in the process last spring, I believe, and then had multiple negative tests because we do point prevalence testing on an ongoing fashion. After getting the vaccine, then tested positive. I believe that we use the rapid antibody testing, which has some reliability in its results, but we partnered on his care or her care with DPH to take a look at that because it really was an anomaly. Other than that, I'm not aware of any.
Commissioner, can I just jump in? This is
yes,
Peter Beeson. I'm the deputy commissioner. We had our incident command meeting this morning, and there were 3 individuals at our Southbury campus just recently who have had the test. I mean, who've had the vaccine, did test for COVID-19. And so the reason that's coming up, they're asymptomatic, but the reason it's come up is we're still testing everybody. So we had a staff that came in that was exposed. And so we keep testing, and there were 3 individuals that came up positive, but at this point they have no symptoms. So if we weren't testing, we probably wouldn't even known they had it.
Well, that's why I asked about the variants, and I'm glad you asked the question, Charlie. I don't remember whether it's the Brazilian, but one of the variants is more likely to cause reinfection with people who had been presumed to have some kind of immunity from infection from the previous or from the vaccine. And no, I haven't looked at the data in a week, and it probably changes. But that is why I asked the question. So, but we don't. Do you have an arrangement with Jackson Labs or through the Department of Health to do sequencing on the positives that you're turning up?
So Commissioner Gifford talked about ramping up sequencing testing at existing labs within the state yesterday. I believe there's some access to that sequencing, but that's a little out of my area of expertise. So I defer to Commissioner Gifford and DPH as to where that's at. Every positive case we alert them to, and we work in close consultation, but that body of work isn't where we are spending our efforts. So, but I'm sure that they are looking at it.
Representative, is this, do you have another question?
No, Madam Commissioner, thank you, and thank the Commissioner, Madam Chair, and thank you, Commissioner, for your answers.
Very well.
Madam Chair, Senator Austin has her hand up.
Yes, I know. Thank you. Senator Austin, I did say your name earlier, Senator Austin. When,
Thank you. Thank you very much. A couple of things, Commissioner. Like everybody else, we all have constituents that are in your care whose family has not been able to see them in a long time. Where do we stand on that?
So we have allowed visitation on a case-by-case basis going back to summertime, maybe even before around July 1st. But in-home visiting has not been allowed, except in certain circumstances. We have reopened committees formed around visitation. Currently, they're about a week into what we're hoping is a 2-week timeline to complete some criteria. When looking at scenarios so that we know if the individual we support is vaccinated, if the family's vaccinated, or if both are vaccinated, how we might look at visitation. And our hope is to restore in-home visitation as soon as we're able. I'm encouraged by the relaxing of the nursing home guidance that was issued. Now that's their entire population, in theory, of the residents is older than ours. So we have a broader range of ages. So we don't have everyone necessarily vaccinated outside of the group homes. But within the group homes, as soon as everyone's vaccinated, we anticipate being able to relax our visitation restrictions significantly.
Thank you for that. I have a family who writes to me. He may be visiting now because he hasn't written me in 4 days, but still writes saying that they have not been able to visit their son, who is not young, but he's only in his 30s.
They write to me as well. I have a good idea of who that probably is. Out in the Wyndham area, perhaps.
Yes. Yep.
So we hope. I haven't heard from him in a little bit either. So hopefully, the provider in that area that his son is supported by, and the case manager have been able to meet and resolve some of those visitation issues. But if not, with the new guidance, we ought to be able to.
And my understanding is, according to the guidance out of, or the data, that those with developmental disabilities are right below those that are older in regards to the impact of COVID. And right now, we're not actually vaccinating those folks who are developmentally disabled but young, even though they could be impacted by this. So have you had a conversation with the administration relative to this issue?
I've had multiple conversations with the administration with regards to this issue, both before the change to an age-only approach to rolling out vaccine and after that. And like many members of our community, was surprised at the change. But I walked through the math with Commissioner Gifford and others, and then we took a look at our own math. So while the staggering statistics and figures that are being shared by advocates with their community are alarming, our experience here in Connecticut, the last I looked at the math, which is about 10 days ago, of all the people we support under the age of 45, less than 1% of those people perished, which is relatively consistent with typical populations. It accelerates after 45 in terms of percentage, and we start to go askew from there on the general population. But in talking with the administration and the governor and Commissioner Gifford, the issue became how you would prioritize that. So at the time that the governor issued that decision, only individuals with Down syndrome were being indicated as needing preferential treatment by the CDC. But there were lots of other things that didn't make sense. Why weren't other disabilities included, including those that have missing chromosome features? They were showing guidance from the CDC that only people with type 2 diabetes, not type 1 diabetes, should be a priority. There's a lot of conflicting suggestions in that CDC guidance at the time. And in an effort to try and set up staging, because that next group would have been a group of around $1.5 million, $1.5 million people. My computer's flashing and it's about to shut down in 10 minutes. So I'll get through this and we'll restart and I'll get back on. The slowdown in trying to coordinate that. What documents do you bring to the vaccinator to prove your disability? You know, there's some physical characteristics for Down syndrome perhaps and other syndromes, but I don't know that our frontline vaccinators, especially people we brought out of retirement to help or people from the Guard who are there to help, people working for the private contractors that we're using. How do you prioritize that? What documentation's needed? Are we going to send people to a doctor's office where they're at risk of getting infected to get something signed by their doctor that they can then bring to a mass vaccination center to get vaccinated? That trying to figure out all those logistics would just slow Connecticut down. And that the best thing we could do for all citizens, including people with intellectual disability, is get as many people vaccinated as fast as possible. So when I looked at the math and what the lag time would have been to stage 1.4 million people in various subcategories versus just rolling this out by age as fast as we can, I don't know that the end result is very different for most of the people we support. It's important to note that if you back out all the people we support under the age of, all the people eligible for the department under the age of 17, you back that number out, we're already over 50% of everyone eligible for the department being vaccinated when you ignore the children because there's no vaccine for them. That's way above what most other populations in the state are looking at. And that's because of the latitude we've used at looking at the congregate settings. I would love nothing more than being able to get everyone who's eligible for me vaccinated. The heartbreaking conversations I had with Commissioner Gifford about who you end up leaving out. Do we leave out the people with autoimmune issues, cancer survivors, people with diabetes? Should obesity and smoking, where should those people be in the line? So it became really, really hard and heartbreaking. And for those of you who don't know Commissioner Gifford well, these are things that strike her as well, but she's very pragmatic. And when she steps back from the emotion and some of that advocacy and looks at what's best for Connecticut, I do believe she makes every decision trying to figure that out. I believe the approach the governor took, while it felt like a gut punch because people thought they were next, I think delivered in the end the same result and gets everyone healthier, safer, faster.
Thank you for that answer. I appreciate it. Thank you, Madam Chair.
Thank you, Senator. The literature from out of England on Down syndrome is pretty scary, so that's all I'm going to say. But I already did my 15 rounds with the Department of Health, and it is what it is, I guess. You're happy, okay? Representative Dathan now, are you next?
I have some questions. Thank you, Madam Chair. And I echo your comments on the IDD community and the vaccines. It is a big concern. Just wanted to ask some questions and apologies if you answered. I've been jumping between a couple different meetings now. In your responses on item number 14, I think this was my question where I asked the metrics for each of your major programs. I was hoping to get a 3-year trend so I would get an understanding of where we were in, 19, 20, and 21, or how much, we have in 18, 19, and then, 19 and 20, and then how much we envision going forward for each of the programs throughout the budget cycle. Sorry if I wasn't super clear if this was the same question, but I think it is.
So this was the question on metrics, and we weren't clear. So we publish a report and we can pull together the snapshots from 3 different years for that report. It's published online. So we measure a lot of things. We have data on a lot of things. So I'm not sure, I'm not sure how deep down in the weeds. So I don't know if you're looking for numbers of people receiving services, numbers of people eligible for the department, if they're receiving services, which type of services, between res and day in-home services versus congregate settings. So we can give you lots and lots of information.
Yeah. Each major category would be helpful of people we actually serve. So people that we have paid dollars for within the budget. I just want to get a trend to see, you know, where we've been and where we think we're going to be going with this budget. Also, I think, and again, because I had a couple things, I may have not asked this question, but for each group home, do we, and congregate care facility, do we have a census trend on those ones that are under our funding? I don't know if you, how easy that is to pull together, just so that we can kind of get it, and all group homes could be put together so we could say, you know, congregate setting for Southbury, for example, you know, congregate setting for one of the other group homes, and then we could have maybe all the other ones. I just want to get an understanding of the people like that we have in the Southbury, for example, and some of the other fully state-run ones.
We can provide you census data for each of the publicly run locations.
Yeah, exactly. And if we can get that sort of 3-year trend, so we can get an understanding of where we've been and then what we're, you know, budgeting with those people going forward. And then I wrote down, I had a question, and I am, to be honest, don't remember if I asked this or not, but it was about overtime. And I'm just wondering, we had a big cut in the overtime by hiring part-time staff. I'm just wondering if you have a history of overtime, so that we can kind of get an understanding how really the savings is compared to what we've had actually.
Sure, we can show overtime reports. Overtime, the way the state does it versus the rest of the world, is a little complicated and a little convoluted, but we'll do our best to sort it out in a way that makes sense. And we can show you 3-year trends. I will tell you that this year is going to look worse because of COVID than the past couple of years. We had actually been positively moving our overtime in the right direction. Scott, do you have any general comment real quick? I saw you pop up.
Yeah, it doesn't look worse. It's better.
Wow, that's amazing. All right, we'll get you those numbers and get that for you as well. The trend on overtime and how we've mitigated overtime expenses over a period of time. Just as an FYI, in 1:47, my computer's going to shut down and then I'll hop back.
Okay. If you don't have a chance to answer, did you answer about the high school graduate placements to determine if there was COVID money for those? I didn't hear it when you were going through the COVID dollars, and that's why I wanted to check.
So I'm not aware that we have a need for additional grad dollars. The legislature's been really very strong in their stance on fully funding grads for us, having rejected several governor's proposals in the last several budgets and pushed that back to a July 1 start date. There's a grid that shows the actual start dates for grads, I believe, in our written responses to you. That shows how they end up staggering through the year. Number 17 on our sheet will show you when the bulk of them we place in the July, and then we have people who come into the system over a period of months. But I'm not aware of any specific COVID dollars to help with that.
Okay, I was just thinking COVID dollars could help with the funding on that one.
I think it could help. I think it could help LEAs, the educational, so the schools and school districts more directly for kids who are not ready now to leave because of whatever the reasons are. They're not ready to leave high school, but I'm not aware of any coming towards us for that issue.
Could I interrupt for a minute? Commissioner, have you said several times that you're about to lose your computer connection? Is that true?
It is true, and then I'm going to restart it and rejoin you as quickly. There's nothing I can do to do. It's going to happen right now.
Okay, I apologize, Representative. I wanted to understand what we were facing here, but if you're coming back, Commissioner, that's fine. Okay, Representative, do you have another question?
I think that's good. I'm going to continue to look through the sheets that the commissioner gave us, but I think those are my main questions. So thank you, Madam Chair.
Thank you. Are there other questions? I see.
Madam Chair, if I could just ask, are you going to go through the questions, or do you want us to just ask questions randomly? I thought we were going through all the questions first.
We are, and I'm looking at question 5 and 6, which appear very straightforward. So it would seem that we could move to number 7, but if anyone wants to follow up on 5 and 6, let us know.
Representative Dillon, this is Krista Ostaszewski from DDS. It looks like Commissioner Sheff is in the process of restarting his computer, so we can do our best to respond to questions while he's in the process of getting back into the Zoom meeting.
Okay, thank you, Krista. So are we okay with moving on from 5 and 6? Number 7 is the need for part-time positions as a result of Southbury Training School.
So Representative
You want to try to take that one? I'm not.
Right. Representative Dillon, would you like us to provide you with just a quick overview based on what's in the response, or are there questions specific to number 7?
I was really interested in whether the committee members wanted to follow up on the response that the
Madam Chair, because you're getting close to the 3:30, if I could make just a suggestion.
That's right.
If nobody has any questions, just move on, because I think as we get farther in, there's more questions, and I don't want to see you lose time because we're not moving fast enough, if I may make that suggestion.
I think you're quite right. And I think some of the answers to the questions later may take a lot more time. Does the committee, we have about 20 minutes left. Would the members like to hop around, which we've done in some other subcommittees, and look at particular questions and follow up on them in the time remaining to us?
I think that might be helpful, Madam Chair. So is the commissioner on yet? Did you let him back in?
It looks like the commissioner's computer is struggling right now, so he's working on it, but I don't think he's back in yet.
So we have a few staff from DDS on the call. We're happy to assist with questions or provide responses as necessary as we wait for the commissioner to get back on. So Representative Dillon, if there are staff members that have questions, we're happy to attempt to try and respond.
Thank you very much, Krista. Do any members have questions on understanding that we are facing a deadline here in about 20 minutes and we have a number of questions remaining? Are there any particular areas of interest that you'd like to follow up on with the department?
My questions, Madam Chair, have to go directly to the commissioner. They're why they made certain policy decisions. So I don't think it's fair to ask his staff since he is the commissioner. So I'll wait personally until the commissioner gets back on.
I appreciate that. Thank you very much. Okay. Well, I will ask a question on funding to private providers for hazard pay.
Thank you, Representative Dillon. So I think that question is related to what looks like question number, I'm looking at our responses here. I know we have it in here. I'm going to defer to Scott, who
we did not provide direct hazard pay to the providers. But we do know that through the CRF money, they were able to, some providers used that opportunity to increase the pay for their individuals. But DDS did not provide specific money for that, but they did it, but providers did it through the CRF funds.
And I don't know if you would be the person to ask this question of did the department provide any directive? Because it seems to me there are some providers that chose not to provide hazard pay out of any of those dollars.
Representative Dillon, the guidance that we have provided was information on just appropriate uses of coronavirus relief funds. And so, certainly hazard pay, could fall into that as a qualifying use of the funds, but providers did not have to. And, as far as I know, I have only heard of a couple. So my opinion would be most did not choose to use the funding we provided for hazard pay.
That was my impression, but really I can't claim to know all of it. Are there other questions on that matter? No? The department, any action that the department has taken, given any implications of the change in the law on special education? I understand that your response is that it's under consideration in the courts, but do you have a plan?
Sorry, I'm getting feedback. Oh, sorry. Yeah, so we've been, in conversations with our sister agencies about how we would plan moving forward, but at the moment, being that it's still under review, nothing that we've been discussing is what I would say a set plan until we kind of know what the direction is.
So what does that mean, Katie, that it's still under review? It's over at the AG's office and you're waiting for them to make a decision if they're going to challenge the ruling? What do you mean by that?
Representative Abercrombie, we just confirmed prior to this meeting that the decision was appealed by the AG's office and is the appeal is pending.
Thank you, Krista.
And thank you, Representative. So are we clear? This just happened. You learned this today, Krista?
I apologize, my mute button was being a little bit difficult there. So I don't know the date of the appeal process that is occurring, but we just confirmed that with the AG's office today. So it had happened prior, but we were able to just make sure that we got confirmation of that right before this meeting. So I apologize, Representative. I do not know the date of when the appeal happened.
Well, I just wondered if there was any information that could be provided to the group after this meeting that would be helpful to understand the status.
We can do our best to look into that, and we can work with our partners over at the AG's office to do that also.
That's great. And maybe we should follow up with the AG. I don't know, but thank you.
I think, Madam Chair, Representative McCarty has her hand raised. I'm not sure if you can see it.
She's muted now.
Thank you. I did ask Representative McCarty, but I didn't unmute myself, so no one knows. Thank you.
Yeah. Thank you very much, Madam Chair. And I first would just like to thank the department for the very good answers to all of the questions. I did just have two quick follow-ups. Wonder if the department, what is in place to help those individuals that have the funding for the day services, but that have not found yet an appropriate provider? Is there anything else that the department is doing to help? I don't know the answer to that question. And then secondly, if you did have the additional funding, you did mention in question 13, your answer. I'm interested in what kind of relationships you're building within the community to continue that work of finding more jobs for individuals with disability and working in partnership with the communities. If you could just expand a little bit on that question, I would be more than grateful. Thank you.
Peter, I'm sorry, DC Mason. I just wanted to point out, Commissioner Sheff actually has hopped back on. I see him he's under a different name, but just wanted to make sure everybody knew he had rejoined.
Great.
Yeah, thank you. And I'm back, and I apologize. It's one of those things that didn't let me delay. It was just doing its own business. So I am back, a little discombobulated, but I'll do my best. But Peter, were you going to answer that question, or did you want me to try?
You can take it if you want.
So I'll need you and potentially Scott for backup. But with day funding for people, in addition to not being able to, if you can't find a program, or currently with COVID, there are some families who are hearing that agencies aren't accepting people during, new people until they're vaccinated and the rest of that. That you can also self-direct that money. So we have a way to move that money into an individualized day program and do self-hiring. It isn't perfect for everyone, but it's an additional avenue besides our traditional day program settings. In terms of partnership with business, we gave an opportunity for providers to request additional chapters of what we call Project Search. The most recent one that made the news a few years ago was the work that FAVAR did with Project Search and a connection to UConn Medical, and it's been very successful at helping people find jobs. Today I saw from UCP that they have, they're encouraging additional enrollees for their Project Search that they have, and their business partner in that, I believe, is Mohegan Sun. And there are 3 or 4 others that have major business affiliations that are internship programs that have a very high rate of success to leading to competitively employed jobs. Beyond that, business partners in Connecticut, Walgreens is probably one of the more long-term ones, is an example of a partnership with industry where they've realized that it's not just a nice thing to do to employ people with disabilities, it's good for their business. They make business decisions that include us and identify a workforce who's ready, willing, and able to complete some of the tasks. So at Walgreens, it's at their distribution center by the airport, but we're looking to bring online additional businesses like that will work with us to develop lots of opportunity in integrated settings for people for work. And I came in late. I mentioned I'm discombobulated. Peter, did I miss anything in that response?
No, I think the only other thing is that we also a couple of years ago hired a director of employment that has helped us in terms of starting us in the direction of employment for all people. And recently they've been working together with the providers to get everybody up to speed where we're going. And that seems to be starting on a great path.
And that, I think that is the other thing that she's done with us prior to the pandemic. We started a reimagining day for people with disabilities. We have the system we have, but if we were to start from scratch, or if we were to reinvent the system, would it look like it does now? And if it didn't, what would it look like? We had to press pause on some of that activity because it was very hard to do that in the midst of everything else providers in the department were facing. But we're looking at reconstituting and putting more effort behind that, because we think day programs could and potentially should look different than maybe they have for the last 30 years.
I appreciate those answers, and I do have a little follow-up, but I'm cognizant of the time that we have, and I want to give Representative Abercrombie a moment to have her questions answered. But I am interested in working and talking to again about the grant program. I think it's fascinating, that recommendation to really help offset some of the costs for the businesses, but may incentivize them to get involved. So thank you very much, Commissioner. I really appreciate your answers.
Welcome. I see Christina waving.
Thank you, Representative. And
hi, Representative Dillon. If you don't mind, I was in contact with Susan Keene, and she said that we have till 4 o'clock, just to let you know, so people don't feel too.
Oh, okay. Good. Sorry.
okay, Kathy.
Thank you, Madam Chair. So, Commissioner, let me start by saying that, I think through the pandemic, your agency has done a great job of trying to support our providers and keep them whole through this pandemic. I think that you've done it better than most. But I'm going to be honest with you, and I might be honest to a fault. I'm disappointed in this budget. I'm disappointed in this budget because I think you had an opportunity to help our families, and this budget does nothing for them. And let me get specific. We know that there's a huge issue going on right now with housing, right? There's no additional dollars for housing when we had an opportunity to do that. Behavioral services, there's a huge lapse there, right? We know that your step down unit that you started has had high return on it. It's been a fabulous program. Why are we not reinvesting those dollars and doing a second unit? We have a huge issue out there. You know it more than anybody, with our IDD population being stuck in ERs because there's no place for them to go, because they need to be stable before they go home. So, I'm disappointed in that. I'm disappointed that we're not taking any of the families off the wait list for the autism waiver. It's been over 10 years since any families have come off that wait list. We had an opportunity in this budget. I'm going to say it for the record. We had a $450 million lapse in Medicaid last year. We had $170 million surplus. This year, we're going to have lapses again, and we're not using it to help the families that need it. So I just, with all due respect, and I respect you as a commissioner, I think you've done a great job. I just want to say for the record, on behalf of the families that I represent, I'm disappointed. I'm disappointed that we had an opportunity to help them more, and we're not in this budget. So I don't have any questions, because I don't know how you defend that. And I think that it's a little above your pay scale anyways. But for the record, I'm disappointed that now we, the appropriations, have to do the job that should have came in this budget. So thank you, Madam Chair.
I won't try and respond or defend that. I will ask you to keep your eyes open with regards to your comment about the step down unit, that I think you'll see, even with the money we're lapsing, you'll hear some news about that shortly. That's near and dear. I know that's near and dear to your heart as well as mine. So be on the lookout. You might hear something more about that part soon, and I'll leave the rest of your comments alone. And I think they speak for themselves.
Well, I won't actually, because I think there's a lot of concern about the behavioral piece, and there's a lot of concern about housing. And I think it's important that the representative brought it up. And Senator Abrams has her hand up, so I'll go on to that. But I just want to say that Representative Abercrombie was speaking for a number of people, and in many ways, you had a really, really tough year, and you don't need us to make it worse, but we want to help the families.
Thank you.
Senator Abrams.
Thank you, Madam Chairwoman. I just want to, associate my remarks with Representative Abercrombie. And I also was wondering, in this budget, is there a place, I think you're very good at what you do, Commissioner, and I think your staff is very good at what they do. And I think that's why it's a little disappointing, because I guess we have high expectations because of that. And normally those expectations are met. So one of the things I was looking for in the budget, if I missed it, please tell me where it is. But some of what you were talking about in the more forward thinking, so like the use of technology, like is there a place in the budget where you've put monies towards figuring out how to best continue to use technology to build independence and work skills and all of those things?
So yes, we can spend money out of both the residential account, the day account, the behavioral supports account. All of those SIDs are set up in a way that that we have flexible spending out of those and can address needs without it being line specific to technology. So a technology line exists within all of our waivers. We've partnered with the Aging and Disability Service and their Tech Act centers to promote the use of technology, the lending libraries of technology, and I will tell you that a lesson learned during the pandemic, families who were not at all interested in using technology a year ago are thrilled at what we've been able to do with technology this year. And as hard as it's been, and as less than adequate as it's been, the use of technology made that blow a lot softer for many families. It obviously wasn't working for all. In terms of housing, so OPM under the prior administration and Secretary Barnes, Governor Malloy, set up a line of one of the SIDs that you authorized and continue to support in subsequent budgets around I-dash housing. It was a very specific set of rounds of housing. And the first one of those, it took longer than I would think. Everything takes longer than I think it's going to take to get that up and running. The initial one is set up by FAVAR in the Farmington area. It's only been open for a couple of weeks for those we support, and I get pictures and stories on a daily basis that are just fantastic. And I'm sure that Steve would love to tell you more about that. Without additional appropriations to that line, but within our existing appropriations for residential and in partnership with housing, I believe we have 3 or 4 more of those in the queue that will come online without a designated appropriation for it because we can use the existing money. And Peter and I and others are talking about how we do that within existing dollars, but we want to incentivize more cost-effective services and provide services that are integrated. And we think that these types of integrated mixed-use housing developments are definitely a place we want to expand in the future. So we see at least 3 or 4 of those coming online between 6 months and a year and a half from now. And those will be opportunities as small as maybe 10 people we support, as many as 30 people we support. And we couldn't do that. Steve DeLella, who's at Housing Now, and the commissioner and others have been such good partners to us that we're excited about that. So while the budget doesn't have specific line items to speak about it, we are not going to stop pursuing additional opportunities and reinvestments to create more opportunities. And I understand fully the desire, there are multiple desires within the agency. Further enhance and stabilize the private provider community. I know all of you have talked about that, and we continue to try and do that within existing resources, and certainly wait list. And we see the wait list issue, which we haven't been able to substantively reduce previously without line items from the governor's office or through your body. But we continue to find ways to do what we can and to continue to sow seeds that will create opportunities down the line. So that doesn't speak to the heart of what you were all getting at, but we're not going to, we won't be resting on our laurels regardless of what that number may look like. We're going to keep trying to come up with opportunities and improvements for everybody we can.
Well, that's one of my hopes, is that the use of technology can allow us to serve, it is a cost saving probably in the long run. And, but I'd like to see those cost savings go into serving more clients as opposed to, money being saved for the budget. That's my hope for the use of technology, is that we can expand our services to more people.
So one of the pieces of technology that I think some people have been reluctant about, but Peter's investigated quite a bit, is remote supports, particularly for overnight hours, where as opposed to staffing the what if and paying for that,
Right.
you staff and pay for an as needed, and on a much smaller scale. Peter's looked, I think, at what states have you looked at that are doing that currently that we might model after?
Ohio is the big state that we've been looking at. And, you know, we have a committee that's working on this. I was just talking to a provider today that has set up a whole system for this that will be bringing that to the committee. And I just want to jump in a little bit about the assistive technology. Through our ID partnership account, we were able this year to put out a grant offering for families and providers to help them purchase assistive technology. So we're still moving forward with helping people to get the actual hardware to assist people with independence.
Yeah. I've been fortunate to be able to tour. I think Representative Abercrombie was with me. And so we saw, you know, that technology can both build the independence, you know, create good independent living skills as well as work skills for clients, but also, you know, give more flexibility when it comes to staffing and living situations, which again, I would say if that happens, I'd like to see it reinvested in, you know, in being able to support more people in our state than just it being the kind of cost savings that just goes back into the budget. And I'm sure you share that, you know, I know that you're all dedicated, and I'm sure you share that hope as well. So thank you.
Well, there hasn't been many positives with the coronavirus.
Yeah.
A lot of providers set up virtual supports, and having that done within the family's house, they were able to see their individuals doing much more than they thought they could do. So I think that all that stuff is starting to see. I think it's going to take us, it's starting on the ground level, but once it starts getting into place, I think it's going to really take off.
So Peter and Commissioner, so when Senator Abrams talks about the technology piece, are you talking about above and beyond what's going on in Meriden with our ARC in the sense that they have the 3 apartment units and they put residents in 2 of them and then they have staff in the 3rd? Are you talking expanding on that? I think it was a pilot, I might be wrong, where we can really save a lot of dollars, right? Because you don't necessarily need the one-on-one, but you have the security there. Are you talking, when you talk about technology, are you talking above that, or are you talking about expanding that?
So that is a use of technology that will be in our book of business, but the amount of technology out there is really, really extraordinary. So there's what we're looking at in Ohio uses a provider that becomes familiar with a number of people. They have copies of their individual plans. They get to know them face to face, but they remotely can support them so that their direct service dollars aren't being spent on some of the mundane things or the what ifs. So Pam Fields at ARC Meriden Wallingford, I think they're mid-state ARC now. They have done a version of that with some technology, but there's actually an opportunity for to bring in or to utilize it on an even broader scale. And multiple agencies that you're used to hearing the names of could pay for this online support technology that we would fund. But there's other technology too. And you know, Pam at Mid-State ARC is certainly a visionary in the way she approaches the work they do there and in reinventing themselves. Neat Marketplace, I believe UCP, I believe there's 6 or 7 tech centers across the state. Yeah. And they have a range of very low technology to very high technology, from very low cost things to more high cost things. So as a for instance, they have stoves with auto shutoffs that in the stovetop itself, you can put your hands on it and it will not be hot if there's no specific pot that sits on top of it. And so, they have shutoffs if no one's been attending to that stove for a period of time. So there's all sorts of stuff that's a lot of the R&D in those efforts are for the aging community, but the same things that would support people in aging can often support those we support now. So we can give you, we can provide you, we put out a newsletter on use of technology for DDS. We do that in conjunction with our partners at ADS. And we'll make sure that this group in particular gets a copy of one or two of those editions, just so you can see what the kind of work we're trying to get at. But it's not just that one or two apartment model. There's all sorts of good stuff out there.
Yeah, I think my colleagues and myself would be interested to see that newsletter, just so that when we talk to families, we can also share that. Yeah, you're right. We do have a tech center here in Meriden. And I think for me, one of the most fascinating things was the sneakers with the GPS trackers in them now, especially because our kids on the spectrum, we know, are wanderers. I found that really, really amazing and something simple, simple,
Yeah.
You know what I mean? So no, you're absolutely right. I think this population, I think grows the most with technology compared to most populations that would use it. So no, thank you for that. And, I agree with Senator Abrams. I've been around long enough that I've gone through a few commissioners over at DDS. And I think each of them had their heart in the right place. But I think that, in just my opinion, you have fought harder than anyone I've worked with in a long time. So for that, I just want to say thank you.
Thank you. I'm happy to take the good with the bad today, Representative Abercrombie.
Senator, I can't remember which Meriden person was last, but was it Senator Abrams? Did you have another question? The technology is fascinating, but could we circle back and put the technology together with Senator Austin's question about families who can't see their loved ones? I know in my own family, the ability to have window visits, it's like a major issue because of a family member who's on the second floor. And so I just wonder, has the department used technology, I assume you have, to reduce social isolation on the part of your own folks, but also in terms of the families?
We have. I will tell you that private providers jumped into that space even faster than we could in public because of our larger settings and the fact that all of the IT in our public settings is under state governance. It's a little harder to get Wi-Fi and and acceptable use technology, tablets or other or state issue cell phones. So it took longer than I would have liked at our regional centers and at Southbury, but we have used technology, and private providers have really done a great job. The unfortunate part is not everyone responds to that blue screen in front of them. So we have people that an iPad just doesn't matter to, or the phones. Then we have a lot of people who love all those toys. So, but we've had to find alternative ways. So screen door visits. We did have the second floor conversation about window visits, and that were we really gonna, how would you accommodate that? But there was a lot of creativity. We did, cars parked in parking lots at 6 feet apart with windows rolled down so they could lay eyes on each other. For families who wanted to know, the conditions of the environment, they would ask staff to walk around and do a FaceTime just so they could see that we're, keeping up the premises during these difficult times and that things were in order. We have very caring and involved families who want to know that level of detail, and providers for the large part bend over backwards to accommodate those types of concerns and requests. It was never perfect. It certainly isn't the way we drew it up when we started the year, but I think providers have been resilient in trying to respond as creatively as they can. They've even shared in ways that I don't think our community has shared previously. Online, if a provider developed an online curriculum, they open that not just to the people they supported, they very often open that up to whoever could benefit from it. Yeah, I appreciate that comment, and I do feel I'm going to get to see my parents on Saturday. Knock on wood, they're both vaccinated inside for the first time. So I do. It's not the same, but it's similar, and I do feel for all the families that have been disrupted by this.
Right. Thank you.
Madam Chair, I just wanted to say I'm going to be leaving now. I have to go back to Human Services. We're in the middle of a public hearing, so I want to help my co-chair, but I want to take this opportunity to thank this commissioner and his staff for being here, and thank you, Madam Chair.
Thank you. And Representative McCarty?
Yes, thank you.
Patiently waiting, I know, thank you.
Thank you very much, Madam Chair. And if I may just go back for one moment and ask the commissioner on number 10, your answer to helping families in crisis with the family grant program. How do the family how do they learn about the information there? And could you just provide us with maybe a little more detail how many of those families are accessing those family supports, and just a little more information on the categories? I see you've listed quite a few different areas, but how do those families find out about those family supports if they're in need of additional grants?
So there's a number of ways they may come to know about that. But when they become eligible for the department, those are resources shared, and it's available on our website. I don't have my cheat sheet in front of me for my staff who are out there, so I may need some help with this one. But the typical family grants are roughly a cap of $5,000 up to $2 a year. We do review and prioritize some of those requests because there are times where we have run out of that money. This year, we're in particular trying to figure out the likelihood of people using money that has traditionally gone for what we call camperships, payments for camps. Because last summer, other than Horizons, none of the camps operated at all, and Horizons operated at a very limited day capacity only. But I do believe that camps will be functioning this year, so we tried to ensure that we had some money remaining for those things, because that'll be a huge thing for a lot of our individuals if they can get to camp this summer. But through their case management, through the helpline, through our website, through our partnership with Connecticut Family Support Network, which works to provide opportunities for families to network with families across the state. The ARC is very good about sharing that information. Is there anything from our response I've left out, staff?
So this is Krista, Commissioner. I have some figures that I can share, and maybe Representative McCarty, this will help with some of the response. For fiscal year 2021, year to date, under 18, we're showing 202 individuals utilize the family grant program for respite. We're showing 32 individuals under 18 utilize the family grant program for support services, and 18 individuals under the age of 18 utilize the program just for miscellaneous services. For individuals 18 or over, again, this is for fiscal year 2021, we're showing 319 individuals utilized the grant for respite services, 214 individuals utilized the grant for support services, and 43 individuals utilized the services for miscellaneous supports and services, and that was 18 or over.
Could you provide that in writing to Christina to share with the work group? That's a great question, Representative.
Yep.
No, and that was very helpful, the response, and that was what I was looking for. So thank you, Commissioner, and thank you, Krista. Thank you, Madam Chair.
And you're fine? Okay, Representative Tyson.
Just a last question for me on the waiting list. Thank you for giving the trends on the waiting list. That's really helpful. Just wondering if there is things that we're doing to facilitate, the waiting list, shorten the waiting list for people. And also, do we envision that in a post-COVID world, what will happen to those waiting lists? And I'm kind of speaking more generally about all lists rather than any particular service line. I was just kind of looking at the different trends, and it was hard to draw a correlation.
Yeah, thank you. So our wait list trended up a little bit this year. I want to go back to some of the conversation that occurred at your last hearing on and the notion of wait lists being brought up. There was a decision made by my predecessor to define the wait list differently than it had been done historically. So historically, the wait list prior to Commissioner Murray hovered between 450 and 650. And then with the decision she made that she would also include our planning and development list, brought us to 2,000 overnight. So there wasn't a huge growth in the wait list. It just recategorized and recharacterized who was waiting and what they were waiting for. Through efforts of DDS Families First, there was legislation that was put forward. We did a census that further reorganized who was in what category and what their expectations were. So we have a better defined wait list, albeit a larger number than we had previously, but it includes different people for different reasons. We did have a phenomenon that occurred in the last fiscal year. So when you're looking at the data that's in the answer, it's as of January 1st of this year, which of course is we've gone through the Thanksgiving and Christmas surges at that point. So our wait list grew. As the numbers have come back down, we've begun to place people with a little more frequency, in addition to being able to get them vaccinated or have quarantine space that's not occupied because of hospital overflow and things like that. So I anticipate that the residential wait list number will come back down, not significantly, but more to where it was in the past couple of years. But we try and shake the system up here and there to create movement within it by incentivizing things, piloting things, focusing on some things that are new, more cost effective, because the cost to, without reinventing certain things that we do, if we just kept doing what we were doing, we could cost out what that wait list would look like, and we would need a very different economy and a very different budget for accommodating those 2,000 people that we say are on the wait list. But we think that we can accommodate many through growing underutilized portions of our book of business. So one of those, for instance, is our community companion homes, which for lack of a better term would look like adult foster care for those not familiar with what our community companion homes are. The agency historically has self-imposed some restrictions that have really limited who would be good candidates for that. So for instance, we have not invested in making CCH licensees' home accessible. So that means anyone who utilizes a wheelchair, unless we find someone who has a fully accessible home, isn't a candidate for that program. So they end up in very costly group homes instead. And they may not need the full level of care other than the accessibility and some care. So we're exploring how we can, we also have not traditionally placed people with significant behavioral health needs in those programs, but we're looking at changing our rates and changing some of the ways we can invest money into those providers. And in other states, that is a tried and true way of reducing their wait list that we still need to explore further. And then those, I mentioned earlier, the mixed use housing developments, originally under the title I-, but they'll be funded by different mechanisms from DOH going forward. We think that those are avenues. We have to increase capacity for the non-residential waitlist people, so sort of broaden the answer to your question. We have to work with providers to increase capacity in day. We have to work with families for what the expectations are, and we have a lot of work to do there. Even though they're very small wait lists, it shouldn't be this hard for families to find adequate and appropriate placement in a timely manner. In those other categories, in BSP and in day services, it's not a lack of funding. All of those individuals are fully funded. They just haven't found a place to spend their resources. And so that's incumbent back on the department to understand why and how we create those opportunities for them.
That's helpful. Thank you so much. And it's really good to hear from you, Commissioner. And thank you, Madam Chair. I'm going to get back to my insurance and also my human services. Hearing. So I've been focusing on this for the last 2 hours, but it's been very interesting. So thank you so much for your time.
Thank you, Representative Dathan.
Good one.
Thank you, Representative. And we have a little bit of time left. And I'll just ask about question 17 on the day numbers. And the July 231, and then it drops.
Yep.
Some of that a function of the pandemic or of policy changes made by your department?
None of it was by policy changes made by the department. And again, I want to thank the legislature for continuing, and our families, thank you, for continuing to make full day funding available for all our grads as of July 1. There's a number of reasons why people don't start on July 1. For some of those previous kids, now young adults coming into our system, maybe it's as simple as the family always goes to the Cape in July and they weren't going to start in July and give up the Cape. Some of those families do other things. And then sometimes there's just not the right program. So that more to what my answer to Representative Dathan, sometimes they just can't find the right fit fast enough. And we need to figure out why that is. We've increased our cooperation and partnership with staff at State Department of Education, who has a special ed chief, who we work with very closely, and we have outreach to and from our schools about what they can do to better prepare kids and get them ready so that our day programs are ready to accept them. And the providers will share that sometimes our rates are not attractive for some of these challenging kids coming out of schools, and we need to do better. So we're aware of that concern, and Peter works on that rate side of that for me often, when whether we can do some things differently to encourage acceptance of those folks. But they're all fully funded for July 1. It's not a policy issue that you've set through the legislature, through the appropriation, nor one we've set. Sometimes it's a capacity issue and sometimes it's a family preference issue.
Okay, well, I'm sure that we'll probably go back to the day programs at some time, but I do want to thank on my own behalf anyway, because so many of my own neighbors are affected by the decisions made by your department. I know how tough it's been, and I do appreciate the work that the department does and the challenges that you face.
So thank you. I will tell you, and I acknowledge this, I've been sending out at least weekly staff communication except for when I was sick, for almost the whole last year. I grew up and was schooled on a principle called person-centered planning, and encouraged family involvement and family decision-making, and that systems are the enemy of individual choices. Last February and March, I threw all of my learning and all of my values around that out the window to prioritize health and safety over individual choice and self-actualized outcomes. And it was the hardest thing I ever did.
Thank you. A lot of those choices were made that way, though, you know. We have 5 minutes left. Does anyone have any other questions? Otherwise, we can wrap up. I know you've been a little bit on the griddle, Commissioner, but
that's okay.
Right. It's because we like you.
Well, I like you all too. I appreciate that your willingness to listen to our families, to those we support, to the staff, and I know you hear it from all sides, and you'll be stuck with tough decisions. So I know you don't envy my work at all times, and I certainly don't envy yours.
It looks like the last word is going to be Representative Ferrara.
Not sure about the last word, Commissioner. Madam Chair. But I just had one question, not for the Commissioner, for you. On the way out of the meeting, Representative Abercrombie spoke about an appropriations health public hearing. I don't have that on my schedule. Is that actually going on now?
It's a public health committee is going on right now.
Okay.
I believe it's raised bill discussions about self-hires in the state of Connecticut, which is why I was eavesdropping before joining you. She made a comment about me spending my time watching Public Health Committee, but there's actually stuff that comes up there.
Okay, it's not appropriations, it's the Public Health Committee. I get it.
It is.
All right.
Yes, Representative.
Thank you very much.
Human Service Committee.
I'm sorry?
I think
I
it's
thought it was Human Services.
not Public Health.
Right.
Oh, maybe it's Health and Human Services. Health and Human Services? Health and Human Services Committee. DDS shows up in a lot of places. Sorry, my bad.
You put me into a panic. I was like, where am I supposed to be?
I'm sorry, Senator. That's my bad. That's my bad.
No, it totally could have been me just as well. So that's why I panicked.
Like
Thank you for your time, though, Commissioner. I really appreciate it. And I appreciate
all you. Thank you.
Very difficult keeping up with all these Zoom meetings, believe me.
I know, it's very weird. Thank you all. And if you have any further questions, or we're going to follow up with the department. It's very weird to be looking at Joe Carvalho here, but Christina Gelman will be gathering everything. I assume for the any information that the members have requested today. And I know that it's been a long process. So thank you very much.
Thank you all very much. Appreciate your support.
Thank you, Madam Chair.
Thank you.
Thank you.
Bye-bye, everyone. Thank you.